Hello, my name's Peter Walsh and I'm Chief Executive of AvMA. I wanted to take this opportunity to share with you some thoughts about the current situation, this terrible pandemic we're facing, but also issues around patient safety and justice, both of which we're so passionate about. Thank you for following AvMA and supporting AvMA. I'll say more about what can be done to help us in our endeavours later. First of all, I hope you're all well and your families are well. And my commiserations to those who've been affected by this terrible pandemic, and the thanks from everybody at AvMA, and I'm sure yourselves, go to the frontline staff, NHS and social care staff in particular. The NHS, thanks to their efforts, has survived the worst of this pandemic. And for most people, they've done an absolutely brilliant job. As ever, there are people who are less fortunate. One of the things that we're concerned about is access to diagnostics and also access to treatment, sometimes urgently needed treatment for people with conditions other than COVID. We've already had some harrowing stories come into us on our helpline, and we're hearing about cases already from around the country where avoidable harm may have been caused or has been caused as a result of late or unavailability of diagnostics and treatment. We're taking this very seriously, and an example of the unique role that AvMA plays is that we've combined with other charities and with medical experts to make the case for a more urgent approach to addressing the huge backlog of patients waiting for treatment and the difficulties in accessing urgently needed diagnostics and treatment across the spectrum, most pertinently seen, of course, in cancer, but also for heart patients, neurology, and other urgent conditions. Now that we're over the worst of the pandemic, we've asked the Prime Minister and the First Ministers of the devolved nations in the UK to urgently accelerate the opening up of services to avoid unavoidable deaths and harm. We hope that this will be done. We'll be giving you the opportunity to make the case for this with the launch of an online petition on the government site any day now. Watch this space for further news about that. Together, we hopefully can get urgent action taken, and that will help save lives, support the NHS, and avoid avoidable harm. This is just one example of some of the challenges that are going to be faced for both patient safety and access to justice. Another, I'm afraid to say, is on the latter issue, access to justice. We know that the government were already planning something called fixed recoverable costs, basically capping the amount of money that lawyers can get when they represent patients who've suffered from clinical negligence. If it went ahead in its worst form, it could seriously damage people's ability to actually challenge denials by the NHS and make it impossible for some to access justice. We think that a society that does that would be a society that's lost its moral compass, and we'll do everything we can to mitigate the damage of that particular policy. Again, watch this space. There will be a public consultation. But we fear that some people will tend to use this pandemic as an excuse for such restrictive measures, restrictive to values such as access to justice. We're expecting deeper, harsher, and problematic proposals that some people are already using the pandemic for to justify rolling back on patients' access to justice. We'll need your help in doing that. AvMA is a unique charity. There's no other charity whose prime focus is patient safety and justice for everyone affected by avoidable harm. We've been terribly affected financially by the pandemic ourselves. For example, our annual conference, which was due to make about £150,000 for us this year, has had to be cancelled, together with all of our fundraising events. This is causing difficulties for us in actually pursuing our work. Anything you can do to help our cause would be gratefully received. Please visit our website. There are details on the newsletter, and you can find us online. You can help tremendously by just becoming a friend of AvMA, joining our mailing list, making a donation of as little as £5 a month, and being part of a movement for change, a movement for patient safety and justice. Thank you, stay safe, and I look forward to seeing you at happier times.